Good morning. It's me, Russell. It's been a while since I've posted a video like this. Man, like over 2 years ago, I posted those trazodone videos, which have gotten a fair amount of views, and I've been meaning to post more videos for a long time, but due to my busy schedule, it hasn't really happened. Looking back at those original videos I did, I look super stiff and kind of anxious, and it's because I was applying to, so I was in medical school, I was applying to psychiatry training programs at the time, and I knew that all of these people that were interviewing me were going to be watching, checking out my channel, because I mentioned it in my application. So I was like kind of feeling awkward about it in advance, if that makes sense. But it's whatever now. I'm already a doctor now and all that, still in residency, so I feel a lot more relaxed making videos now. I've got a nice yerba mate. I've got some incense. And, I've been meaning to create videos that are like high production, buying fancy stuff and screens and losing weight, because I've become quite fat in the past 2 years. I'm working on losing it though. But I realize like videos are just not going to happen unless I just start small and kind of slowly build my channel. So here we go. Today I wanted to make a short video about anhedonia and the potential treatment options. By the way, I am sorry, there's like 600 construction jobs going on at once. I'm sorry for the noise. But anyway, anhedonia, this is a seriously neglected symptom of various psychiatric disorders. It can also be a standalone symptom that's not technically considered a mental illness, although it's still a dreadful thing to experience. And anhedonia is the inability to feel interest and pleasure in anticipation in previously enjoyed activities or interests. In reality, though, it goes farther than that for people that have anhedonia. It includes just emotional numbness in general. Like, people with anhedonia generally tend to not only feel pleasure and joy in things that they used to love, but their emotions are just flat. So people with anhedonia will often not feel much of anything, even sadness and despair. A lot of people with depression don't feel depressed at all. They feel nothing or close to nothing. It's like going your life with everything being black and white, having your everything muted, turned down in volume. It's a dreadful thing. I've had various people describe it to me, and in all these studies for treatments for depression, it's essentially never specifically addressed. They have, they'll show through general rating scales that this drug or this therapy or that intervention decreases depression scores in general, but they rarely look specifically at anhedonia. When they do, they find that anhedonia is difficult to treat. It often remains after the other depression symptoms go away, and it's a serious risk not only for relapse into another depressive episode, but it's a serious persistent risk factor for suicide, even if someone technically isn't depressed anymore because their PHQ or their HAM-D score, however you want to trend depression, is low. And I say it's neglected because it is. It's, I've been a doctor for 2 years now. I'm in the middle of getting training to become a psychiatrist specifically, and it's rarely addressed. And I think that's messed up. And I know there's millions of people suffering. There's like a whole subreddit about people that are anhedonic and they don't feel like they've gotten help anywhere. So I want to list some options, potential options, that people can look into with their doctor that could potentially help anhedonia. And some of this is based in okay scientific evidence, peer-reviewed stuff, but because it's such a neglected symptom of psychiatry, a lot of this is hypothesizing, and I want to tell you that up front. Quick disclaimer, I'm not your doctor. None of this is medical advice in the video. Don't make any changes to your life that could have an effect on your health or mental health without talking to your doctor first. Okay, anhedonia. So what can we do to treat anhedonia? First-line treatments for depression, which are selective serotonin reuptake inhibitors, or SSRIs, tend to not work well for anhedonia. Sometimes it does. Sometimes people's anhedonia truly will improve, but a large percentage of the time it is unaffected, barely affected, or even worsened sometimes. Serotonergic medications, not including SSRIs, but also some of the older drugs, it can tone down strong emotion. Now, if you're super sad and dysphoric and anxious, that's the kind of depression you have, SSRIs can be a godsend. If you have a depression that's characterized by not feeling anything, no anxiety, no interest in anything, no pleasure, you know, just numbness and anhedonia, SSRIs there's a very good chance that it will not help with those types of symptoms. So what does that leave us with? So bupropion, which is Wellbutrin, has specific antidepressant effects for anhedonia. Like there's studies showing that anhedonia markedly improves on Wellbutrin. This is a medicine that boosts norepinephrine and maybe dopamine. It's considered a norepinephrine dopamine reuptake and releasing agent, reuptake inhibitor and releasing agent. But I mean, I won't go into it, but I don't think the literature on humans shows that it boosts dopamine significantly in the human brain. It does in rodent brains. But anyways, regardless, it does help many people with anhedonia, and there's studies to show this. And if I can find them, I will link them in the description below. So that is a great option for people that have more of a blunted, you know, low energy, numb kind of depression. It's also been shown that drugs in general that boost catecholamines, which is norepinephrine and or dopamine signaling, tend to help depression. This makes a lot of sense, actually, because anhedonia is, there's the reward circuitry in your brain, like the nucleus accumbens, the ventral striatum, it's not working properly, and the pleasure centers of the brain, very complicated of course, but a huge component of that is dopamine signaling. Dopamine is a key to pleasure, especially anticipatory pleasure. When you actually consume or experience something pleasurable, yeah, dopamine is a big part of that, but then you get into things like opioid signaling in the brain, endorphins, and all of that. So it makes sense that things that boost norepinephrine or dopamine instead of serotonin, or despite also boosting serotonin, also might be a reasonable thing to try with a doctor's guidance. There's other ways to boost dopamine, though, beyond just normal antidepressants. In fact, antidepressants rarely boost dopamine. you can get like high doses of Effexor, which starts boosting dopamine. There might be some downstream effects on dopamine with Zoloft and Prozac, but really it's the older medications that are rarely prescribed anymore that will affect dopamine, specifically monoamine oxidase inhibitors, especially those that inhibit monoamine oxidase B. This creates a conundrum for prescribers and patients because it's culturally not seen as appropriate anymore to prescribe these because they're dangerous in overdose. There's some dietary restrictions, and most doctors don't even want to go there. It's a liability thing, to be honest. But things like Nardil, phenelzine, this old monoamine oxidase inhibitor, probably works a lot better for anhedonia than like a purely serotonergic medication. And norepinephrine or noradrenergic boosting medications probably work better too. So there's things like Cymbalta and Effexor. The problem with those is they also boost serotonin a lot, which can cause emotional blunting in some. But anything that boosts norepinephrine might help anhedonia. And notice I'm saying a lot of maybes and mights. As I said in the beginning, this is not, the evidence is just like, there's not enough to say anything for sure. There are other ways to boost dopamine that are not controlled substances like stimulants and that are not antidepressants. These are things like dopamine receptor agonists. This is like pramipexole, Requip, or however you say it. That's really prescribed in psychiatry. I could be saying that wrong. I think it's Ropinolol or something like that, generic. So there are small studies showing this does help with anhedonia, specifically. The studies are small, so it's hard to say for sure. And then, of course, stimulants, methylphenidate, etc., also can help anhedonia. This is tricky to get prescribed, though, unless you have ADHD. Although it is used in treatment-resistant depression, sometimes, especially in geriatric patients, older patients with depression that are super low energy. So far we have Wellbutrin, we have potentially other norepinephrine boosting medications. Mirtazapine might also. It's hard to say, that does a lot of other stuff and it can be very sedating, but that potentially could work. And then dopamine receptor agonists and other things that boost dopamine will probably, are more likely to help than, you know, serotonin medications. So what about things that aren't medicines? There is a specific type of therapy called behavioral activation that targets anhedonia specifically. I try to tell everyone I know about this because there is a non-drug thing that you can do, usually through a therapist, but if you're like motivated enough, you could probably do this without the assistance, or at least weekly assistance of a therapist. Behavioral activation has generally been a component of CBT, cognitive behavioral therapy for depression, but also it can be used as a standalone therapy. And compared to CBT, generally, it works pretty much just as well. So it shows that behavioral activation for many people is likely the active ingredient in therapy for depression, CBT for depression in general. Behavioral activation is interesting because it's essentially trying to coax super depressed, low motivation, anhedonic patients to just start doing things again. And this is the key. If you have anhedonia, the things that you used to love are no longer pleasurable, or at least it's a severely blunted pleasure. So when you try to convince someone with anhedonia to go and start playing guitar or getting into music or hiking or playing sports, whatever it is that they like again, it's a tough sell. They're like, why would I spend time doing this? It's not fun anymore. It doesn't bring me any joy. And the key is you have to convince the patient that if they do it long enough, the reward circuitry in the brain will start lighting up again. And this is true. You know, the first couple days, weeks, or even months maybe for some people, scheduling previously pleasurable activities, you know, after a while will start regaining its pleasure. The neurons in your brain will make connections again that tell your brain, that was interesting, that was fun, I should seek out this again. And there's been functional MRI studies showing this, that the reward circuitry in the brain will light up and start working again if you just start scheduling activities and doing this behavioral activation over time. So in summary, for depressed patients, if they just go out of their way to do things that they used to love enough and enough over time, the pleasure will start to return for many people. So there's that. The last thing I want to touch on, we're already at 16 minutes. The last thing I want to touch on before ending, and this is like, I've got like 10 hours of video that I want to make about this, but the best evidence thus far shows that for many people, the reward circuitry abnormalities, the low dopamine signaling, the anhedonia seen in depressed patients, etc., for at least a subset of patients, is due to neuroinflammation, inflammation in the brain. If your body is inflamed, your brain is also inflamed. Inflammation very easily reaches the brain, and then your brain will actually participate in inflaming your brain even more once it's been alerted by cytokines and stuff like that. So the microglia in your brain, which are the immune cells, the guards of your brain, when it senses an insult, or it's your body's sending inflammation through the blood-brain barrier, or directly from gut inflammation through the vagus nerve, it will start doing things because it thinks that it's warding off a viral, bacterial, or fungal infection, even though most people with chronic inflammation have inflammation from other things like obesity, you know, bacterial overgrowth in the small intestines. It can be autoimmune diseases, the SAD diet, standard American diet, misbalance between omega-3 and omega-6 fatty acids. You know, there's plenty of reasons why people in Western societies are inflamed. And inflammation in the brain and microglial activation has been shown to do really damaging things that explain anhedonia pretty well. It reduces dopamine signaling, it reduces receptor activation, like D2 dopamine receptors. It decouples the reward circuitry in your brain, like the nucleus accumbens, from the rest of your brain. So you might have a perfectly healthy reward center of your brain, but if it's unplugged from the rest of your brain and from your consciousness, it's as if it's not there. Let's see, those are kind of the main points of inflammation and anhedonia. And this makes sense. Just do a simple thought experiment. People, like when someone gets sick, let's say they have the flu, or heaven forbid, COVID now, or they've had a bunch of vaccines and they're feeling just like this, you know when you get sick, you feel this sense of malaise, low energy. If next time you're sick, if you really are cognizant, you'll realize that you don't really want to do anything. Like, you just want to lay in bed. The things that you usually enjoy doing are not pleasurable when you're sick. And this is mediated through brain inflammation. Luckily, there are things that people can do to lower inflammation. And of course, this should be done with a doctor's guidance. And it depends on the person. But in obesity, adipose tissue, fat cells, constantly secreting cytokines, these proteins that signal inflammation. It's releasing other nasty things, especially if you're a man, like estrogen. People that eat a standard American diet are not going to have enough omega-3 fatty acids in your blood and in your brain. That's also going to cause inflammation. Yeah, the standard American diet is potently inflammatory. People that are sedentary, people that have insomnia, people that have, small intestinal bacterial overgrowth, people that have inflammatory bowel disease and other autoimmune diseases. Inflammation is a key to some people's anhedonia, as far as I understand the research. And I'm going to make a whole video about potential things that people can do to lower inflammation. But, oh my goodness, it's already been 20 minutes, so I'm going to sign off for now. Hope this wasn't too much rambling. Thank you to those that have been asking in the comment sections about, like, where have you gone? Are you still going to make videos? I appreciate you checking up on me, and I hope to make more videos as time passes. I'm actually moving in 3 months, and I'm gonna have like a much chiller schedule, and I'm gonna have like a whole room dedicated to making videos and stuff. So hopefully I'll have kind of more pretty looking videos soon, but for now I'll talk to you later.